Our group chose Betty Neuman as our theorist, best known for the Neuman systems model. Betty Neuman was born in 1924 in Ohio and received her nursing diploma in 1947, went on to earn her bachelor's degree, Master of Science in Mental Health, and eventually a PhD in clinical psychology. She has 2 honorary doctorates, and she is a fellow of the American Association of Marriage and Family Therapy, as well as a fellow of the American Academy of Nursing. She is the founder and director of the Neuman Systems model. After school, she worked as a nurse in charge nurse. She also worked as a school nurse, industrial nurse, and clinical instructor. She pioneered community mental health nursing in the 60s, developed the systems model in 1970, and the model was published in 1972. Her first book on the systems model was published in 1982, and her model continues to be instrumental in influencing patient care. Neuman is currently retired in Waterton, Ohio. Due to World War II and other events, the worldview of nursing in the 70s was focused on advancing nursing practice as a profession that moved beyond a task orientation mindset to one that established nursing as a significant area of professional practice and academic attainment. Some events that led to the advancing of the nursing profession were the Nurse Training Act of '64, which allowed the development of graduate programs in nursing. Prior to this, the graduate programs were in education and others. In 1966, the ANA got rid of their no strike clause. This gave nurses the opportunity to fight for improvements in work conditions. Through collective bargaining, nurses were able to have a voice in decisions that affected patient care, such as safe nurse-to-patient ratios. In 1965, the ANA published a document, Educational Preparation for Nurse Practitioners and Assistant Nurses. And during World War II, blood transfusions, trauma care, triage, rehabilitation after terrible injuries on the battlefield, surgeries, and techniques discovered because the war changed science, medicine, and nursing forever. The work of the theoretically rich era of the 60s and 70s was driven by a sense of urgency, and according to Walker, this urgency stemmed not only from internal sources in nursing to demarcate and domain, but from external events in which nursing was dismissed as lacking its own disciplinary focus. In the 60s and 70s, nursing developed a political agenda that included parity with medical practice and more autonomy to meet the newer, higher healthcare demands. The nurse practitioner movement, due to increased demand of access to healthcare, was in response to the Medicaid legislation of 1965 and the Johnson administration. Please watch this video, Nursing in America, History of Social Reform. The foundations of Neuman's model are primarily Selves stress theory, von Berntoleff's general systems theory, Kaplan's level of prevention, Lewis field theory, and Desjardins' philosophy of life. The Neuman system model has similarities to Gestalt theory, which states that each client and client system is surrounded by a perceptual field that is dynamic and equilibrium. This picture shows the Neuman systems model format, where the nurse assesses, makes nursing diagnoses, makes goals, plans, implements, and then evaluates. First utilized as a teaching tool, the Neuman systems model had the purpose to help graduate students in helping them find clinical nurse specialization program choices. For example, the war served as a philosophical underpinning because Neuman understood that people coming from the war would have different physiological, psychological, and sociocultural needs than someone who had not endured that kind of trauma, hence the importance of viewing the client patient as a whole and as someone that is influenced by the environment. Betty Neuman believed that nursing encompasses a holistic approach. The Neuman system model focuses on a systems approach that acknowledges the human needs, the management of their stress, and how the environment impacts them. She believes an individual is a whole in which mental health cannot be separated, and honed in on the implications of stress on patients and individuals being an open system. In this system, energy flows in and out of the client. Neuman believed that each individual or client is group as an open system, unique composite factors and characteristics within a given range of responses contained within a basic structure. She believed the client's in constant exchange of energy within the environment, believed that several known and unknown stressors exist, and each can influence the client to varying degrees. The Neuman theory stems from general system theory while focusing on the client as a system, including family, group or community resources, and their responses to stressors. The 5 variables include physiological, psychological, sociocultural, developmental, and spiritual. There are 3 levels of prevention to manage stressors: primary, secondary, and tertiary. Neuman's theory relates to nursing in that nurses can manage their stress levels in the workplace. Nursing, health, patient, and the environment all tie into the management of the client. When caring for the client, the following factors must always be taken into consideration: physiological, psychological, physical, mental, social, cultural, developmental, and spiritual well-being. A system is open when its elements are continuously exchanging information and energy within a complex organization, and stress reaction to stress are basic components of an open system. Neuman's theory relates to nursing in that nurses can manage their stress levels in the workplace. Neuman's theory in relation to health states that although a patient may become ill, their health can be restored when placed in the right environment and given adequate support. Nursing, health, patient, and the environment all tie together. Here, we see the meta-paradigm concept. As noted in this chart by McEwen and Willis, all the concepts are interrelated. Each client has similarities and differences, as demonstrated by the core principle. Each individual's pathway to homeostasis will look differently depending on internal, external, and created environments and factors influencing the individual. Variables will assist in bringing the patients back to a place of balance and equilibrium, especially when they learn to adapt to their stressors. Here we have a chart showing the definitions of the concepts of Neuman's systems model, such as the flexible line of defense. The concepts connect as a whole because all humans require basic structures to survive. Clients have boundary lines in order to remain safe. Without boundaries, just as children, people will place themselves in harm's way daily. With boundaries come the degree of reaction where each unique individual reacts differently to stressors. The behaviors have a large part in the amount of time it will take to return to a balanced state. Other important factors are the environmental influences. Flexible lines of defense act as individual warning signals to prevent them from danger. Input and output occur with the flow of energies leaving and entering an individual. For example, if a depressed patient's oxygen is low, the priority would shift to respiratory. Neuman's focus is to channel energies where it is needed. The patient's mood may surely be impacted by lack of oxygen to the brain. Negentropy would be present as the patient is given oxygen and begin to stabilize. As open systems, energy is constantly flowing in and out. Once the patient is stable enough to breathe and depression is addressed, they can return to a normal line of defense because they are not feeling threatened. An intervention for this situation would be to monitor their oxygen closely with a pulse oximeter to prevent low oxygen or place them on continuous oxygen. Reconstitution may occur if the patient requires long-term oxygen and chooses not to wear the oxygen for personal reasons, resulting in poor health outcomes. Stability would occur if the patient gets the oxygen and therapy that he needs. Wellness would be achieved if his respiratory status is managed. Neuman viewed human beings as a client system made of 5 interacting variables, as mentioned. Here we have the basic structure, energy, resources at our core, and then the lines of resistance, normal line of defense, and flexible line of defense. At the core, if our temperature is not where it should be, our lines of resistance and lines of defense kick in. In clinical practice, the theory is used as a framework to help nurses care for patients. In education and administration, the theory is used to develop nursing knowledge. For primary prevention, secondary prevention, and tertiary prevention, we have an example being a stroke patient and preventing wounds. Here we have a nurse charting the patient to prevent wounds. Primary would be a patient after they had a stroke and have no wounds. We implement all the interventions to make sure that they don't get a wound. Secondary is when we notice a small non-blanching area and we up those interventions to prevent it from becoming a wound. Tertiary is when the patient has an actual wound and we prevent it from getting worse or improve it. Here is a chart of interventions. We have primary, secondary, and tertiary prevention, what the nurse does with their diagnosis, goals, interventions, and outcomes. So the research was used for the theory in a clinical study method where the theory was applied in the process of caring for patients. One participant was a woman with urinary dysfunction, and what we did is we had them avoid beverages with caffeine, not limit the fluid intake due to possible kidney damage, and to drink at least 8 glasses of fluids, but reduce the fluid after sunset, pour warm water on the peri area to stimulate urination, make sure to have good hygiene, and the key findings show that the clients were willing to follow the guidelines after the nurse explained their effectiveness. Neuman's theory can be applied to practice to improve patient outcome. Theory can be applied in education to equip nurses with knowledge of caring for patients. Here is a video of nurses acting out the Neuman systems model. According to McHugh and Willis, Neuman's theory is not considered to be parsimonious as its model is complex and parts of the model functions in multiple ways. The focus of the theory is to view the person as a whole. It may appear simple, but it is very complex. Each of the 4 concepts have subcategories. Neuman's systems model is too abstract for direct empirical testing by means of research.